So let's spend some time on the different drugs to treat diabetes. And let's start with the good old Metformin, which was until recently the first-line drug for diabetes management in a patient with type 2 diabetes. It's very cost-effective and it's very effective general. How does it work? Well, its target is the AMP kinase. I mean, it's still not 100% clear, but I think the AMP kinase is considered the primary target, so it's an enzyme, and you find it mainly in skeletal muscle and liver. And what does it do? Well, similar to insulin, in the liver, it shuts down glucose production because it inhibits an enzyme that is a couple of enzymes that are very important for glucose production, making glucose from scratch in the liver, gluconeogenesis. It also decreases some cholesterol, triglycerides, and fatty acid synthesis, which is a beneficial kind of side effect. And then also it helps us upregulate this GLUT transporters that take up the glucose into skeletal muscle and also into adipose tissue. Let's talk about the therapeutic effects of metformin. We're going to do this now for every drug because in diabetes the therapy is so individualized, so we always want to consider a couple of things that are very important. So number one is, how does a drug affect the A1C levels? Because you may treat a patient that comes in with a very high A1C level, so far away from goal, so you need a highly efficacious drug. In contrast, maybe someone comes in with an A1C level that's just a little bit above goal, so you need a low efficacy drug is enough. So arbitrarily we put the drugs into the three categories, being highly efficacious, moderate, or low, meaning how much do they lower your A1C. So highly efficacious drugs are considered the ones that are lowering A1C above 1.5%, so more than 1.5%. Then we have moderately efficient drugs that are lowering your A1C within 1.5 to 1 range, or just a little bit, so below 1%. So now with metformin, we lower A1C above 1.5%, having high efficacy. Now, the next question that we need to ask, is there a risk of hypoglycemia? Because that's something very dangerous. And for metformin, it's very clear no. Actually, only really one drug class can lead to hypoglycemia. And we're going to discuss in a couple of minutes. These are the sulfonylureas. Really, the drugs that lead to hypoglycemia are the ones that kick out insulin independent of the glucose. That means whatever you eat, it doesn't matter because they just kick out insulin, or you take insulin, obviously. But metformin, as it just like helps insulin getting better or helps storing away the glucose, is not leading to hypoglycemia. Also, metformin is considered weight neutral. So we always need to think about drugs, how do they affect your weight? And metformin is considered a weight neutral drug. So let's talk about the adverse effect of metformin. So metformin is a very well tolerated drug. It causes some GI discomfort, like you get nausea, vomiting. It's usually when you start metformin, and what you can do is just like take it with food. Then the GI discomfort will get better. It's a very common adverse effect, so it's very common. Most people have some sort of GI adverse effects when they start this drug. Then we have another adverse effect that is a very rare, but can be fatal, and that's lactic acidosis. So again, very rare, but you have to know about it. And what happens in lactic acidosis, as the name already implies, your body builds up too much lactic acid, so you're going to have acidosis, and that can lead to multi-organ failure. Now, usually lactic acid is removed by the body within the liver, and This process is blocked by metformin, by downstream AMP kinase. So you may build up lactic acid. However, there are certain risk factors. So patients where this is more likely to happen. For example, if patients with kidney disease, because metformin is eliminated via the kidney. So the more metformin you're going to have, the more this process can be blocked, the more lactic acid is going to build up. So patients with kidney disease have a higher risk developing lactic acidosis, as well as patients with liver disease, because the liver is responsible for removing lactic acid. And then also tissue hypoxia, so having not low levels of oxygen in your body can increase the risk to develop lactic acidosis, because low oxygen also leads to lactic acid production. So what are examples? Like heart failure, patients with any other cardiopulmonary disease which leads to low oxygen. So these are all risk factors, and if you start someone on metformin, you should check for these risk factors, just to be aware of the increased risk of lactic acidosis. Again, it's a great drug. It's very rare, but you have to be aware of it, and also need to watch out for warning signs of lactic acidosis. Again, blood gets too acidic, and this can lead to multi-organ failure.